Hi guys, welcome to another Yin Yoga class. For this class, I really encourage you have a strap or something that is strap-like, so that could be a rolled up t-shirt, and also a bolster or pillow. We're working the hip flexors today, and the variety of openness and range of motion in a person's hip flexors can really vary. When you're ready, get yourself comfy and come to lying down on your belly. Bring your elbows out wide and create a shelf with your hands. At first, just put your forehead on your hands. Take a nice big breath into the belly and make sure you're not feeling any sharp digestive pains with having your belly contacted on the ground. Shimmy your hips side to side and wiggle your toes back to try to find some space along your spinal column. Extend the head long, crown of head, so top of head long away from your torso. And start to settle the breath. And bring your left cheek to your hands or on the ground. If you have neck sensitivity or a permanent change in your neck, I encourage you to have a pillow underneath your head instead of your hands. The first pose today is a simple diaphragm release. By turning the head to the side, we are stretching out the dense connective tissue that runs from the side of our neck, underneath our collarbone, through and behind our heart space, and dives into the diaphragm through the spinal bone connection. This is a very subtle yet profound posture when we have a release. In general, in a Yin Yoga class, we want to live embodied in the body space. But with common cultures, it's not really easy to do that. We tend to live in our head. So when you first start to notice and settle into the body, give the brain a little bit of space to process its thoughts, be a little chattery with itself. And it's a way for you to non-judgmentally and with a little bit of grace accept your reality and give the brain some time to settle. Right, this mindfulness we are practicing by allowing our thoughts to wander in and out as they need. It allows us to start recognizing the deeper details of the ecosystem that is our body, is our being. As an individual, if we get better at understanding our flow and cycle of our body, we tend to be able to show up for it better, take care of it better. And when we do that, there's an opportunity for there to be less pain or discomfort if you struggle with chronic pain. Nice, big, deep, full cycles of breath into the belly. Allow the external stimulation of belly pressing into the floor help anchor your mind to the body, to the sensations. Good, take a nice full breath. Gently bring your head back to neutral position and have the opposite cheek come rest on the shelf of our hands. Breathe deeply into the belly. Another reason we're starting with this posture is we're going to be working specifically around the hip flexors, which is actually a group of muscles and can have a myriad of different fascial connections throughout the pelvis, hips, and belly based off your unique lived experience. And one of the bottom attachment sites of the diaphragm overlaps with the top part of the hip flexor complex, the psoas muscle. So if we have tension or a lack of tone around our diaphragm, that can have a ripple effect into the psoas part of our hip flexors. This can affect and adjust the pitch of our hips, either forward or back. So we very passively and with time open up each side of our diaphragm slowly through these two poses. We're indirectly changing the soft tissue structure around part of the hip flexor complex. So it may not feel like much, or it may feel really intense, really depends on the person. It will help you find the felt sense of big belly breathing and how it can have a global relaxing effect for our soft tissues. Nice big full cycle of breath. Slowly wiggle the toes. Very gently bring your head back to neutral, forehead on the ground or the pillow. Take a body scan through the center part of your body, down into your hips. How do things feel? Bring your hands out from underneath your forehead. Bend your left leg. Have a strap handy. If you know you have tightness in your hip flexors. Encourage the knee to move away from the hips so you're finding openness through your quads, the front of your thighs, and you're encouraging your front of your hip, the hip flexor area, to come closer to the ground. And then bend your knee so your foot comes closer to your hips. If this is enough stretch, stay here. If you want more sensation, grab the strap or your hand and grab the ankle. You can turn your head to one way if that feels comfortable for you and not too much of a strain on the neck. If you increase the stretch and you're starting to feel intense sensations through your belly and side body waves, back off. Remember, we're trying to find a space of around 60% stretch capacity. And then with time, that sensation will build as tissue slowly starts to open. Try to allow the belly to be soft. With the belly soft, breathe into that space. See if you can feel a gentle shift of motion with every cycle of breath deep into your hip flexors and into your pelvis. A lot of us hold tension through our belly space. It's quite natural for us to guard through that area. Indigestion, GI upset, etc. And then if you're someone who has a uterus and bleeds, every month-ish you have a cycle of change of chemicals that causes muscle tension to increase and then decrease. Knowing these natural cycles of our body or some of the different causes of tension through our low belly space can be empowering to educate yourself about. Big breath in and out. Let the leg go. Gently shake out the hips as the leg goes long. Bring the opposite foot up. Again, first encourage the knee to move away from the torso so the front of our thigh is more pressed against the ground and maybe even the front of the hip is closer to the ground. And you take a breath here to evaluate how it feels. If you're seeking more sensation, then you bring the ankle closer to the hips. You can wrap a strap around the foot to pull it in, or catch it with your hand. Find a comfortable position for the head. And then we sit and wait. Take a nice big breath in and out. Try to keep your attention focused around your hip bowl, the pelvis, the belly, and the deep breath. softening the hip, relaxing tension through the glute region or the butt muscles that may hold your hip in a very rigid position. You deepen the breath to soften the hip flexor complex. Big breath in and out. Gently release the leg. Shake out your hips and feet. Bring your hands out from underneath you. Bring them wide, elbows up. Squeeze the shoulder blades together for a moment and then relax. Bring the elbows down and lift your chest up onto your forearms. Very low landing seal pose or cobra pose. So for this version of spinal extension, we're wanting to feel sensation through the low back space. We are finding foundational core strength. You're not engaging the superficial ab muscles. Instead, we're trying to engage our pelvic floor by lifting our spine gently out of the pelvic bowl. We find a nice, gentle corseting in of our transverse abdominis. So when we take a big inhale, we feel the diaphragm moving down, the ribs expanding, and the belly is generally keeping the same position and tone. The subtle foundational core engagement will allow us to hold this posture without dumping in the bony structures of our spine, specifically the low back, and it will allow us to find a release through the back musculature and hip muscles that attach on to the vertebra of our low back. So go slow with the introduction of this posture. Think less is more. And I will give you a cue in the middle of this hold if you're still looking for a deeper stretch through the low back. Soften your glutes. Relax the tension of the back of the hips. You can bring a pillow, stack it tall, let your head rest on it. Or, to help find that foundational core, you think crown of head moving away from the hips to lengthen the spine and engage our stabilizing spinal muscles. Alright, we're about halfway through this hold. If you would like to increase sensation, bring your elbows closer to your torso, and or if you've practiced this pose before, you can lift your elbows off of the ground, coming into the full presentation of seal pose. Crown of head is long, stabilizer muscles are engaged. You're finding extension through the spine, but not hyperextension by dumping into the spinal bones. Nice, big, deep, full breaths into the front of the hip and pelvic bowl. Good. Let your body go. Arms come long in front of you. Full body stretch. Big breath in. And out. And however it makes sense to you, come to sitting. Bring your hands out behind you. Bend the knees, soles of feet on the ground. Right ankle hooks on the outside of the left knee. Right knee opens up. Gentle figure 4. We're slowly starting to extend the resting length of one part of the hip flexor muscles, the iliacus, the one that connects onto the hip bowl. So we're softening the glute muscles. We're keeping the spine lifted out of the pelvis. And we're encouraging the right knee to go wide. Allow yourself to come back to the body, the brain, went to the to-do lists, the reenacting of a conversation you had, a gentle daydream. Ground yourself into your body. Send the awareness to the subtleties of the right hip. Feel the knee being heavy and dropping closer to the ground. Stay with the breath. Let the leg go long. Switch sides. Right, the intent of this pose is a little bit different than most figure 4 stretches if you're familiar with this pose. In this specific posture, we're thinking ankle flexed, and we're encouraging the knee to go wide, and we're stabilizing through the opposite hip. So we're finding an expansion happening through the front of our pelvis. And with time, as we hold the knee wide and keep the ankle flexed, the space between these two bones has the ability to open and soften. So, with your thoughts, soften the glute region, root down through the opposite hip, and let the knee feel heavy. Big breath in and out. Let the legs go long, shake them out. Bring the soles of the feet together, knees go wide. Butterfly position. Shimmy the sits bones back so you find bone stacking of spine lifting out of the pelvis, stacking the head gently over the hips. Requires a lot of hip opening to be able to feel that bone stacking, so no worries if you can't feel it today. With time and consistency, that ability may change. From this position, come to standing on your knees. Extend your left leg out wide to the side. Ankle is flexed, knees at a 90 degrees. And from here, slowly let your supporting leg slowly move out to the side as well. This is called half frog, really opening up our inner thigh space. And from here, again, we want to find that foundational core, lifting our spine out of the pelvis, so belly button slightly to spine to find that core sitting into the transverse. And from here, since we have so much mobility in our hip, encourage the torso and the hip to move forward and back until you find that sweet spot of femur bone or leg bone, feeling centered in your unique shape and orientation of the hips. And then we find our spot, we settle. If this is really intense already for the inner thighs, bring a pillow, put it underneath your hips for some gentle support. Bring the ground to your body. Where does the mind go when the postures start to become more intense? What is the tone of your thoughts? How is that tone reflective of the self-talk that you give to yourself day in and day out? Big breath in through the nose. Exhale some of that intense energy that you feel in your hips. And to get out of this posture, slowly sink your hips back till you're stacked over the supportive leg. Bring the working leg back to center. Maybe give yourself some gentle self-touch of your inner thighs to quiet down some of the intense sensations you're feeling in that area. And then we're doing the opposite side. So come to standing on your knees. This time, left leg moves out wide. Ankle is flexed, knees at 90 degrees. And then you slowly let the supporting leg move away from your pelvis, out to the side. Remember, bring the floor to you if this is very intense for the body. And as we first get ourselves oriented in this position, we move our torso and hips forward and back. And we find the sensation of our leg bone landing evenly in our hip socket. And then we get quiet. We get still. And we simply observe and notice sensation. If you want the mental challenge and toughness, really hone in your focus on the sensation of the hips and inner thighs. Witness the build and change of sensation. Keep pulling your mind back to your body. And if the hip feels very intense, notice and try to find the areas of your body that have a joyful sensation to them. Keep the mind anchored to the breath. If you're finding it really difficult to stay embodied, to stay in your body, give your brain a task. A nice big breath in. Exhale through the mouth. Gently rock the hips back and move yourself out of this posture. Come to sitting on your knees. Take a nice breath in. And then sink your booty down between your feet, so widen the space between your feet. Extend one leg long, and then bring your elbows down behind you. Let your torso land on your elbows. This is a deep opening for the leg that is bent through the front of the thigh and hip flexor. Use pillows as needed to support your hip and body. If this feels okay, you can keep lowering your torso down till you're lying all the way down on the floor. If this is really intense on the bent knee ankle, put the pillow underneath the shin. You'll still get the same amazing benefits. Big breath into the belly. Bring your hand to the bent knee, hip. Maybe gently start to touch around the inner hip bowl. Encouraging this tissue to soften. Relaxing the tension in your facial muscles, the skull, neck, shoulders, chest. Breathing deeply through your full vertical torso. Finding ease and tension where you can. encourage the mind to come back to the breath. Anchor yourself into your body. Play with the arc of sensation. What details can you notice? Can you observe the sensation building, finding a plateau, and then softening? People can describe it as like a spiraling open of tissue, a melting, a release, sometimes physical, sometimes emotional, specifically with the hips. Be a witness to the ecosystem that is your body. See it shift and move with every input and output you give it. Big breath in and out. Transition to sitting. Both legs long. Be gentle with your knee. Shake out the thigh. And transition to the other side. Bending the knee, supporting your lower body with bolsters and pillows as needed. Bring yourself down to your elbows. Take a few big cycles of breath to make sure this lands in the hip. And if you want more sensation, lay yourself down. Or if you want less sensation, come up onto your hands. Big breath in through the nose. Out through the nose, gentle snore in the back of our throat. Breathing through upper nasal passages, strengthening the back of our throat, tongue. Warming the breath with each inhale through our nose, to allow it to reach our lungs at a better temperature for our internal body. Pulling your mind into the left hip, softening where you can, relaxing the thigh tissue, softening the gaze to give your body a better opportunity to feel the arc of the sensation change through the hip. Big breath in and out. Transition yourself out of this posture and come to lying down on your back. Let your hands rest on the front of your hips. Feel the temperature of this area and place your hands on a different part of your body. Can you feel a difference in temperature? A witnessing of increased blood flow to the area. Allowing an environment for change in tissue length to take place. The removal of very natural and normal cellular waste to flow out. And for the exchange of oxygenated and nutrient-rich blood to flow in. One final big breath together. Empty all the air out. Inhale through the nose. Open the mouth, let it go. Stay here as long as you like. I'll keep the video running for another 5-10 minutes. I'm going to end the class here. Thank you all for participating. I hope it landed. I'll see you next time.